the host of Here's to Your Health on LA Talk Live, Joshua Lane.
Well, we're back. This is Here's to Your Health on the LA Talk Live broadcast network. I'm your host, Joshua Lane. While Dr. Footsie, the podiatrist, is setting up his display, I am going to be introducing him. Podiatry is an important field, and there's a lot of problems. Okay, Footsie, right over here, please. This is show business. We're going to use these. Dr. Footsie is a podiatrist. He is now a retired podiatrist, and he has been working recently as a cartoonist and also has been involved with, that's your chair, right? And please put those headphones on. Yes, this is a very laissez-faire operation here, and very laissez-faire. And so, Dr. Footsie, welcome to Here's to Your Health. You speak right into the microphone.
Good afternoon, and how are you, young man?
Very good. Happy to have you here. And so, for the listening audience and the viewing audience, so you're a graduate podiatrist.
Right.
And what school did you graduate from?
Well, I went to two schools. One I did my first couple of years in New York.
At the New York School of Podiatry.
Correct, in Harlem, okay. And then I transferred. My father was working for the government, and then he came to California and got a job here. And then I transferred to the San Francisco School and graduated in 1968. So I spent 2 years up there, and then I came down to Southern California because my parents were living in Long Beach, California, and then they stayed there. And then I was going to try and set up office in Watts, okay? Because I went to school in Harlem and hung around people of all different. It didn't matter to me, and there was a great need for what I was trying to do to bring to the community. But in 1968, I guess it was right after they had the Watts insurrection.
It was a bad time for the
Right, and I didn't know. And so everywhere I went, and I'd be driving along on the street, and I saw a place that had a storefront for rent. And then they said, is this for rent? I'd like to use it. And they said, well, what do you want to do with it? I said, well, I'm a podiatrist, and I'd like to open up ground level. And everywhere I went, everybody notoriously would say, oh, it's rented already. So this kept going on for a couple of weeks. I said, wait a minute. So then one guy said to me, he says, why don't you go to Compton? I said, where's Compton? Never heard of Compton. He said, oh, you drive a couple of miles up, and you can either turn left or right, and that's what I did, and wound up seeing a storefront, and wound up renting, and set up practice in January 3rd, 1969. Well, a few years back, so that's where I am. So I come along. Actually, if I can give you a little background, but I remember. I don't know where you're originally from, but like I said, I grew up in New York. You didn't really need a driver's license. Or at least my father said, hey, he didn't trust me behind the wheel to give me driving. So I didn't get my driver's license until I was probably about 21, something like that. Because you always took the buses, you took the subways,
sure.
Wherever you had to go.
City, right.
Right. You had transportation all over. And I had just bought from a guy who got drafted into the service in, I think it was 65. I bought a 58 Chevy Impala convertible. I loved it. He took great care of it.
That was a lovely car.
Oh, yeah. And so I'm going to make a little story out of this. So, I guess we were going, I lived in Queens, but I was born in Brooklyn. And so I was looking for directions, how to get. So somebody said, oh, you go west, young man. I said, okay, go west. So anyway, make a long story short, I wound up going west, wound up some kind of way. I went through the Holland Tunnel, the Jersey Turnpike, went to the Ohio Turnpike, and then the Will Rogers Freeway. The next thing I'm looking, I said, what are those things growing there? And the guy said, those are palm trees. I said, trees? The only trees I saw where I thought were in Brooklyn were between the cracks in the sidewalk.
Right.
Anyway, voila, I made L.A.
Okay, that sounds good.
Yeah, that's, it's a little side story. It isn't totally correct, No. But, I feel honored to be here, to have a chance. And I've been on the radio before, but this is the first time radio kind of TV.
That's right. This is new technology.
Yeah, and I got black. So I remember black
is good.
Black and white TVs.
Black is good.
When I was a little kid, maybe about that, maybe 2.5 years old, I was on TV. And I did great till my mother came in. And then she said,
Then you froze up, is that it?
no, she said, get off the furniture. That's good stuff. So I got off the TV.
I see. Well, that's okay.
You
Bada
know,
bing. Thank you very
It
much.
was an old joke. Okay.
It is an old joke,
I'm,
but
I'm sorry.
It's okay. We're both older men. It's no problem. I like older jokes.
Right.
So with podiatry now, one of the areas where people recognize podiatry can be helpful is problems with the diabetic individual.
Right.
Diabetic foot. People who have diabetes don't realize that, man, their feet are not healing. They have wounds on their feet, and they can lose a toe, and they can lose a couple of toes, and they can lose a foot. So it isn't a joke at all. So what does the podiatrist do for the diabetic?
Oh, okay. Now, I've been in practice since 1969. Been retired for about 10 years, but I've always kept active because I've been involved with youth in the community. I've gotten into art and cartoons with messages of violence and drugs. But about 2 years ago, I developed, I knew there was a great need with the diabetics. Do you know that every 20 seconds, for as I say, as long as it takes to maybe lace a shoe up, someone in the world will have lost a limb due to diabetes? That's a lot of legs.
It's a lot of suffering. It's a lot of suffering.
A lot of suffering for not only for the patient, I'm sure, but for the family as well too.
Oh, God,
and
yeah.
it's very expensive, with the time lost from work and with the expense of hospitalization, et cetera. That's why the federal government come involved with several years back with offering diabetic shoes for the diabetic to prevent the loss of limb.
What's a diabetic shoe?
Well, it's specially molded kind of shoes that the doctor would have to take a measurement of that, but the patient has to be a diabetic. It's covered under Medicare, so I think they had to be at least.
Is that an ongoing program now?
Yeah. You have to be, at least a senior, okay. And the federal government thought it was easier to do that than to expensive to keep paying to have the patient going back and forth to the hospital, lose a toe, lose a foot, lose a leg, and with all the expense that happens that way. They thought it was cheaper to prevent.
Well,
preventative medicine.
They're smart. Prevention seems great. I guess the problem with prevention is if you prevent the loss of limbs, people say, why are we doing this program? The loss of limbs hasn't gone up. So prevention works, and people criticize it because they see the bad things didn't happen. Well, that's because we have this program that's preventative. Mm-hmm. So I'm in favor of prevention. Obviously, that's what we do on this show. But I can see how prevention is the way to go. Do you think that medicine and podiatry and dentistry, are they moving to prevention? That's I guess, too broad a question.
I think they probably always have, but maybe more so, especially now with the new health care that, the government's trying to cut back on expense and stuff. And I still think we have the best health system, in the world. Or, at least people have a choice where they can go. And even people that couldn't afford it, there was always a way that they found for those people to get covered, whether it's a county facility or whatever, okay? So I'm not going to get into the politics on that level. But, when a friend of mine, I had developed a program, and I've been working with youth for over 40 years against drugs and alcohol and tobacco. And the best way I thought to get the kids at their level was through cartooning or through art.
Sure.
And so I learned art without formal training as a kid growing up. And they wanted me to go to art school, but I didn't. I thought I was going to be an athlete, and the only athlete I wound up being was athletic feet and all that kind of stuff. But anyway, so even with my patients, I had always doodled and I drew some things at them to explain to them why you got the problem. I think education is the key to everything. And I think education should always be fun in order to make, it's just like even with our regular educational system of school. If you made education fun, you wouldn't have kids worrying about, I'm not interested in this, and they go out in the street and they're doing this and that. The mind is a beautiful thing that it's got so much knowledge, and the more you find out, the more you find out you don't know.
Right.
Okay.
Right.
And so with doodling and creating the cartoons, a friend of mine, he had said, well, we've got we developed a tobacco prevention program about 4 years ago that's actually been approved by the LA Unified School District. Nobody has funding. And the thing is,
really?
And I did it for years before in the Compton schools and different other areas. And 10, 15 years after I did the program, I'd see young kids see me at a store, and they'd look up to me and say, oh, Dr. Foots. They shorten Footsie to Foots and whatever. I said, okay, where did I meet you?
Dr. Foots works. That's good too.
Yeah, well, whatever. So they said to me, he says, oh, you brought that giant puppet to Roosevelt Elementary School on the no smoking. I said, what'd you think? He said, great. And these were, they were 10, 15 years or 10 years after, and they had prevented them from smoking. Not that kids didn't still pick up the habit. Do you know
Well, you helped some kids, and they actually remembered, which is actually very flattering.
Well, I'm kind of a character, maybe not to remember, but
yeah. But even if you character or not character, if it's really the message, and obviously you were effective as a teacher, so these kids thought enough of the message to remember it and to tell you years later. So that has to be flattering.
Yeah, and I do appreciate that I did something. So and I worked with kids in the inner cities, and the reason why I got into that. I had an old patient many years. His name is Gus. I never remember his last name. But this was many years. You're talking 40 years ago. And I knew his sister worked at the hospital. I mean, his aunt worked at the hospital. And she wanted me to see Gus, his foot problem. So he'd come in. I forgot what he had, the problem. But I always noticed something strange. Again, I wasn't too familiar. Every time they'd come into my office, they'd say, oh, excuse me, before they were in the patient, I got to use the bathroom. Okay. Found out afterwards, a couple of months after, that he had overdosed on drugs. So there was a big drug problem out there that I was just unaware of it. Right. Just doing your thing. You didn't know that they were taking medicines and popping them, and he evidently overdosed. So it got to the point, because many years ago, I had sponsored kids in sports. We formed a nonprofit organization called Footstep Sports Club, and we came up with a slogan called Healthy Feet, Sound Mind, Run from Drugs, A Life Without Crime. And
that's good.
Oh, yeah, and I'd sponsored 4 basketball teams, 2 baseball teams. Might have been something else, I can't remember. A couple of people went on to play in the NBA. David Greenwood, who played at UCLA and then played in the pros. But the thing is, and what attracted them, because we had little tiny feet on the uniforms. And I realized that kids are very impressionable. They want to have something that nobody else has. That's why, with all the doodling, I wound up creating a whole line of foot cartoon characters called The New Feet on the Street, with music and everything. And we were ultimately going to sponsor the kids that way. And so the thought is that I wanted to get a message across, and hopefully not only to prevent foot problems, but to save lives. I mean, feet are very important. Feet are the foundation of the entire body. When you look at it, when you look at both feet, there's 26 bones, usually in each foot. Some people may have more, accessory bones, etc. So the time you double the 2 feet, let's see how good my math is, that's 52. And if I remember it, I think there's 206 bones in the entire body. So 52, so that's about 1/4. The only thing I remember about quarters was my mother would send me down to the dentist. Oh, get a 1/4 pound of lox. I said, okay, I got down and went 1/4 pound of lox. But anyway, but the thing is that it's so important that we take care of our feet, because that's the entire structure.
Right.
And we don't realize. And most of the problem comes from wearing the wrong, improper shoes. Now, I can tell you with women in particular, now they're so particular about what they want. And, of course, it's more of a big stylish thing. Me, I'm at the point, I don't worry. I want to feel at least comfortable. I'm not going to worry. I could tell you stories of girlfriends and women that went out with over the years. You go out to the movie theater. Soon as it gets dark, the first darn thing they do, off come them shoes, because they're killing them. Right. But they don't care what they're doing, because it looks stylish. So they're jamming their toes, they're jamming their feet into it, and that's where you develop the bunions and the hammer toes and all that kind of stuff.
So you're saying that high-heeled shoes
because
are not a good idea for women, health-wise.
Not a good idea for men, too.
Right.
But didn't they have...
That's true. Thanks for clearing that up. Thank you very much.
But many years ago, and when the shoe industry first started, and the shoe was a protective covering. It was mainly originally a sandal. But it became like a status symbol years ago, because, as you notice, the people of more aristocracy, the more wealthy people, they had more of the platform kind of shoe. The higher up the shoe, it meant more
status.
Yeah, status. I was going to say
Oh,
stigma.
that's interesting. Okay.
Yeah. Okay. So that's what.
I did not know this.
Yeah, and do you know how the difference with the women's shoe that when they wound up doing it, it became a sexual attraction thing because they found out as the heel got higher, the calf muscles stood out. You changed the hip movement and all that. So men were more attracted, not so much to the shoes. We were looking at the legs and whatever else. So it became a physical kind of attraction. So women would more rather do that and not worry about where they kill and worried about whether they would attract a man from the opposite sex or whatever. And so that was the situation that occurred there. So we had a pro.
So is there anyone these days who would say that, Footsie, you're wrong about that that these high heels are not bad for you? Everyone kind of knows they're bad for you, don't they?
Well, because what you're doing, you're putting all the weight and all the force is being driven through the ball of the foot at the metatarsals. Well, you're up higher. I mean, I think as a kid, I used to always try and wear my mother's shoes, or I'd take them out of the closet and try and walk. Oh, they'd kill you. And how would you even balance yourself?
Right.
You got a little point of a heel. I said, hey, man, I'd rather do without sex. Or what I would rather do without. If I'm going to worry about attracting somebody to get in a pair of shoes, forget it.
Well, it's a good thing you're not a woman then, because
right, for
must be
sure.
thinking a little differently.
Yeah. Well,
okay, so the high shoes is really as a problem.
Yeah.
So what about men? What kind of shoe is best for a guy to wear?
Well, I think always to wear a good supportive shoe, a shoe that's fit properly. Shoes should always. I got a cousin that's in a shoe business. He had a place called, I think it was called the Shoebox, somewhere in the valley, and he would mainly with children's shoes. But I remembered that, and it's an art it takes to measure the feet, to measure them.
Yeah, for sure. Yeah,
and you should be measured usually at the end of the day, because your feet gets a little wider. You're standing on it. Yeah. So basically, if you're going to get measured for shoes, it should be at the end of the day. As opposed to the beginning of the day.
Well, thank you for that. Actually, that's lovely insight. That's practical insight.
Yeah.
So what about when people wear sneakers? Or should I wear shoes that are leather that breathe?
Well, that's true. You want to use shoes that do have the breathing. Now, the cheaper shoes, and I could understand what's happening in the economy. People are looking, whatever they can afford to buy, they buy. But if the shoe doesn't breathe, you start building up that moisture in there. And then along comes my little friend. He's not my little friend. I mean, that's when you start meeting humongous, among us, the fungus. So you start getting, he loves growing in warm, dark, moist areas.
Right.
So that once they get into the skin, and then it gets further into the skin, it gets into the bloodstream, it starts getting into the nails. And then you got a little more problem trying to treat a fungal problem that way.
Right.
So, I mean, it becomes a whole different avenue. But
so just taking it a little further. So then really, in your opinion, largely we should be wearing leather shoes and maybe sneakers once in a while, but not all the time sneakers.
Well, you can get sneakers that are the breathable kind.
Are they something new now?
No, I think they've always had. I remember used to always wearing the high tops. I forgot what the name was.
What, the Keds?
Well, yeah, Keds, and then they were out here. They were Vans, and but they also had the high tops.
Keds were before the Vans, weren't they?
Keds were back east when I grew up. Vans is only recently, I think, California.
It's a new phenomenon.
Yeah, and of course they make them all the styles for the kids on the skateboards. They're on this, they're on that, blah, blah, blah.
Right.
You got to take a balancing act even to get onto some of these things. I could never.
Or be 13 years old and do it.
Well, maybe even then. Even when I was 13, I was pretty athletic. I don't know if I could. Well, maybe I could have balanced on. Although, I don't know if you're not from back east. But
no, of course I am.
Oh, you are from back east? Oh, I didn't know that. You don't have the accent like I have. I have a Georgian accent now, so I'm getting better.
I thought you were from Alabama myself.
No, I'm Atlanta. I'm a peach.
I was mistaken.
But anyway, I remember we'd play a game, and it was dangerous is what you think of it. When they had the big snowstorms back east in New York, and, you'd always, and of course, the schools will close when you had a big, we all look forward to that. So we were out in the street after the snow stopped, it piled up high. And naturally, the street sweepers, whatever, the garbage truck, they swept across the snow. But anyway, so the cars would come by. Well, we had something we called skitching. I don't know if you ever heard that term. Skitching. It was a combination of skiing and hitching, like hitch riding. So we'd lay low behind the cars in the street. You'd see a bus, a truck, or a car go by. And as soon as they went past you, you'd run out. You'd grab behind the bumper. We must have been crazy. We must have had the brain damage early. And we'd grab it, and we're holding on to the bumper with just our little galoshes or whatever. And they're taking you for a ride. Well, one time it stopped short. And I remember I slid a little bit underneath the bus. I said, oh, man. So anyway, so that's...
Well, I remember that sport, as a matter of fact. I'm not saying I'm as proud of that, but I remember that sport.
Oh, okay, okay. But we were getting back to... I was going to try and get back to the diabetic program that I created.
Right.
Well, I created this tobacco prevention program based on a cartoon character called Tobacco. Now, I got all these words, and
Nice.
I came up with all these words, and I've actually built giant puppets, and I've been all over the country. Actually, I've set up a booth 7 years ago in Washington, D.C. at the World Health Organization on tobacco. Drove across country, set up a booth, and just try to show people what we were trying to do. And trying to make it a fun way to teach tobacco education to prevention and get to kids at their level and using the cartoons. Do you know that every single day in this country, even though the tobacco industry don't want to say it and whatever, there's 1,100 kids that pick up the habit of smoking each and every day. Now, I'm a witness to that because at 11 years old, I used to pick up cigarettes off the street, the butts and all, and we thought we were cool because you didn't want to get germs. So if it had the first filters that came out, I think around cancer, we'd break off the filter. You didn't want to have germs, right? You'd put it in your mouth. Well, then my parents let me smoke after I got bar mitzvah on my 13th. Oh, wow. Okay? And, of course, you're learning how to inhale. You're blowing the smoke rings. You're blowing it up your nose. You thought you were so cool. You had all the nicotine stains. Well, I quit on my 18th birthday, which you're talking about now. It's 52 years ago I quit. I just cold turkey stopped because it was all the big cancer scare. I was afraid. And then that was it. And to this day.
That was in 64.
No, this was...
Surgeon General's report came out in 64.
I was born in 43, so I was 13. I was 56. I was 18 in what year? 61.
Okay.
Would that be right? Yeah. Okay.
Because I thought the Surgeon General's report came out in 64, the first time the government...
Oh, but yeah, but maybe the
so
government...
you quit before that.
Oh, yeah, but they were scared. What do you smoke? My father smoked for years. My sister smoked. My father worked for the government. So he'd always get the cheaper cartons from the Navy, and it was like 10 packs in there, and it cost you $1. It was like, that's what he'd buy for. And then my sister would be smoking... I think she smoked Lucky Strike. So I'd always, she was older than me, so I'd always take a pack from them. Wasn't called, you'd smoke. I got up there, I was smoking a pack and a half a day. But I thought it was cool and all that. But I quit on my 18th birthday. And to this day, and even after that, the smell of tobacco on people's breath or on their clothes lingered on. But with the secondhand smoke. So when I developed a character called Tobacco, we developed something as a unique way to educate kids. We developed, I didn't bring one with me, it's called Dr. Footsie's 20 Tips. And of course there's cigarettes in there and there's the tip on it. So and we made it with trading cards. So you had to collect all the cards. So each kid, when we did it at the school, they'd get a flattened box with a character called Marlon Burrow. Hi, I'm Marlon Burrow, the back-ass jackass. Well, of course, he thought he was so cool. He was like the answer to Joe Camel. But he had no teeth in his mouth and all that, and he smoked and all that kind of stuff. So I was trying to use him as a way, hey, you don't want to be like him and get stuck on smoking. So he was on the thing, Marlon Burrow. And the name of his cigarettes was Ascents, because he's a mule, right? Okay, so the idea of this program was kids had to collect all 20 of the trading cards. But in each pack, I'd written 9 short story books, so there's a little book in there, Dr. Footenstein's Tales from Toland. This is the tale of tobacco. Anyway, so they'd get that book. They'd get a pledge card. I pledge never to use tobacco in my life. They'd get what else would they get? They get a pledge card, a card that they could use in case they wanted to get. We'd give them discounted stuff if we were selling on the internet. And then they had 4 trading cards, but they didn't know which 4 trading cards they get. One might have said, kick butt, or one might have said butt beach. And what it was a picture. Everyone had a cartoon of tobacco in it, okay? And this particular one, I'm trying to remember how it went. There was like at the beach, and you were building out, somebody had built out of the cigarette butts, they'd made like a castle and all that kind of stuff, like the sand castle. So it was, and on the answer on the back, the message was something like, butt beach, something like, our beaches are beautiful, don't ruin our pretty beach. Something, I can't remember the exact. But the classic one I think that I made, Tobacco's walking on a sidewalk, and he's coming past the storm drains, the sewers, whatever. And right in that area, it was after the rains and the floods, okay? And you could see all the water, and you could see hundreds of these cigarette butts, going to go down the drain. So I called, the caption on that was filtered water.
Oh, my goodness.
So,
Good for you.
Yeah, so it
Good
had a
for
message, yeah. So, but the main thing that I didn't know if you wanted...
That was a good one.
Yeah, that you want me to... So the program was pretty effective with the kids. The only problem was the school district didn't have any funding. And people all over the country that liked my program said, how come you can't get funding? Well, it's the same old story. The same money goes to the same people. Just like the tobacco company, they did all those settlements with each and every county or state tobacco control. And it was some kind of a sweetheart deal in there that the people could use that money to balance budgets, to do what they want to do. In fact, I think in L.A., they're using a lot of that money, not so much for tobacco prevention, but for policy. And what good is policy? Okay, policy's great. Everybody goes, so okay, there's no smoking in the hotels, there's no smoking in the restaurants, there's no smoking out in the street, there's no smoking. But when kids pick up the habit, once they pick up the habit, they're addicted with the nicotine.
Right,
you got a problem. Then, so the tobacco industry doesn't care. We got more people to sell the tobacco
really
to. So it's a vicious cycle.
Dr. Footsie, we are running out of time. I have to invite you back because you're
Okay.
a marvelous guest.
Oh, really?
Yeah,
God
you're a
bless.
marvelous guest. And how can we get in contact with you if people want to call you on the internet or your phone number?
Okay. It's pretty easy.
Yeah, go ahead.
I go under the stage name of Dr. Footsie.
Right.
I have a website, and it's drfootsie.org. So it's drfootsie.org. Now, if you want to reach me by email,
Go ahead.
it's drfootsie@drfootsie.org. If you're so inclined to use the telephone, you can get me pretty easy number. It's 310 New Feet by letters. I've had that number since 1972. So it's 310-639-3338.
Well, Dr. Footsie, thank you very much. It was fun.
Yeah,
and intelligent. Thank you.
I look forward to coming back. So maybe we could talk about my diabetic awareness program.
We certainly can do that.
With Sugarfoot and Sweetie Toe.
Oh, my goodness, Sugarfoot. I used to watch that TV show.
Was there a program, Sugarfoot?
Sugarfoot. It was great. It was early 60s.
I don't remember that.
This is Josh Lane with Here's to Your Health. We're here with Dr. Footsie. We're going to take a short break, and we'll be right back after these important messages.